But then all of a sudden I started getting a lot of fatigue, getting night sweats. I was meeting with the physician's assistant at the time, went through all the symptoms, the impact that it was having on me, just personally being able to do things. I was falling asleep by 7:30 in the evening because I was completely drained after being at work all day. If I would do work out in the yard or something like that, after a couple hours, I'd be going inside and having to take a nap because I was just physically drained and exhausted. The response at that time was, well, sometimes you just have to deal with it. And I said, yeah, you know what, you're right. So I dealt with it my way. I was diagnosed with essential thrombocythemia back in 2012, and most recently been diagnosed with myelofibrosis almost a year ago. It was actually just by chance. I had recently switched jobs and was going through pre-employment physicals, things like that. And one of the flags that came back on my blood work were my platelets were extremely high. Had some initial follow-ups with my primary care physician, had recommendations to go see a hematologist. Went to one of the local hematologists to where I'm from. It's kind of a rural area, and we did a bone marrow biopsy at that point, and it came back that I had essential thrombocythemia. Here a couple years ago, my physician was moving, so getting care transferred over to a different one of her colleagues that I had at the time, and transition went pretty well at the time. Nothing different. And as we went along, there was something in the blood work that she decided that, hey, there was something we needed to take another look at. So had my second bone marrow biopsy about a year ago. And at that point then found out that I had myelofibrosis, and it was basically confirmed that, yeah, the myelofibrosis on the scale of 0 to 3, I was in the 3 range. So had pretty significant amounts of scarring in the bone marrow. But at that point, there was nothing going to change with treatment. But then all of a sudden, I started getting a lot of fatigue, getting night sweats, getting a lot of the symptom burden that it was coming with some of the myelofibrosis. And I had an appointment to actually visit with my doctor. And I was meeting with the physician's assistant at the time, went through all the symptoms, the impact that it was having on me, just personally being able to do things. I reached out to some people that I had worked with through the one of the research foundations, and they had contacts throughout the MPN community, and I was looking for other options, just if nothing else, to get a second opinion. With that switch of location, my new physician actually sat down and explained from the very beginning with the ET all the way through MF, what could MF become, things like that. So really explained, not just to me, but to the others, and made sure that there was an understanding there that this is what's going on. This is what we do to treat it. We talked through different clinical trials, different medications that were available. Certainly went through the symptoms and some of the things that I was dealing with at the time. And my hemoglobin was pretty low at the time. I was down in the 8-9 range, and we were looking at one medication that was getting ready to come to market versus other ones that were available. It kept getting delayed, and they're like, you know what? Let's switch medications now, and if we need to switch again, we will. No problem, but let's get you on something different now. And made the switch, started went on ruxolitinib, and it was amazing how quick the symptom burden actually was reduced. I was able to stay up in the evenings and watch movies without falling asleep, things like that. So just from a quality of life perspective, it was far greater than what I had before with the other treatments. So yeah, I kind of taken that and am a strong advocate not only for myself but for other patients, because there are people out there that maybe don't have the resources within a reasonable distance to be able to go see some of the MPN specialists, or may not know who to reach out to get additional input or help or anything like that. So um, certainly advocating for oneself and for others is great. If we look at how many people are actually going through something similar, how many cases do some of these hematologists see? I may have been the only one that they've ever seen with this condition, may have read about it, may have had some course study or something about it, but it's not super common. So making sure that number one, I don't know that the physicians always have all of the information available. Um, Me personally, it was just not being satisfied that, oh, just trust me, I've got things covered for you. Well, I want to know, I want to go out. So yeah, there is some frustration at times. Certainly when I hit that roadblock where just deal with it. I was well enough informed. I certainly not an expert, but I knew enough that, hey, there are other options out there. And for them to not be in the conversation at that point, it was very, very frustrating. I mean, I left out of that appointment very unhappy, and um, yeah, almost you felt abandoned almost, right? You're putting your trust in your provider, and for them to just be like, deal with it. Eh, sorry, I want something better. So after my myelofibrosis diagnosis, we even had conversations around stem cell transplant. And one of the things there was, although we don't need it today, let's do the work, make sure that we've got things lined up, because in the event that there's bone marrow failure, or things progress into an AML, or things don't go as good as we would like them to, we've got options. And so went through the matching. I was very fortunate. I've got my brother is a full match for me, so that's certainly helpful. We've got multiple people on the donor registry that are full matches for me. So the prospect for me is very good in that avenue. The maintenance side of things, it's about every 3 months. I have follow-up visits. I do routine blood work throughout. I've got like you'd alluded to, I benefit from working. We've got a clinic on site that can do my blood draws, so I coordinate those, send the results back up to the Cleveland Clinic and to my physician. They review them. Hey, everything's good, or if there was anything that was looking a little funny, hey, can we have this rechecked, or whatever it may be. So from that impact, it's very minimal to me. Um, the the visits, the nice thing with working with them is, by doing some of the blood work, I don't need to actually physically go to the Cleveland Clinic every time. I've been able to do some of the remote visits, which is, again, quite a savings from a time perspective. Um, it takes me about 3 hours to get to the Cleveland Clinic from where I live, so it's not overly burdensome, but it's not, hey, it's not the most convenient either. So you plan for the day, kind of thing, right? Um, and really the plan is we go forward is monitoring the blood work, making sure that if symptoms are returning, that communication side of things with the physician, they're certainly available, whether it's them, their staff, through emails and things like that. So they are very responsive to questions and needs and things like that. And then just from the broader perspective, just through some of the outreach stuff that I've done and working with the Patient Impact Council, I was actually fortunate enough to spend time with a number of physicians and researchers recently, as they were going through and seeing some of the cutting edge. Here's what we would like to do. Here's what we think we can do. Here's what we want to trial and see if there's any validity to these studies. And hearing it from their perspective. But then the nice thing is we were actually there to provide a patient perspective on how meaningful is that impact to a patient. And a lot of it's been a lot of the treatments available are quality of life, reducing spleen size, symptom load, things like that. But when we can truly get to the point of disease modification and we can really change the landscape there, that'll be the fantastic point that we can get to. So that's one of the things that we were actually talking about recently was how do we get that education into the hands of physicians, into the hands of patients, and into the broader community so that it's more readily available. And actually it was interesting because as we were sitting through and talking, in a group setting, one of the physicians I've seen probably hundreds of patients with various MPNs, and I've hit on some of the things that the patients, have just brought up in these conversations. He said, but it's making me rethink what is, how are my interactions? What are my dealings with them? And this is a specialist that deals with MPNs that's really starting to think of, well, wait a minute, I might have missed this or missed an opportunity here, or could have helped the patient in these avenues. And it was really fantastic, right? Is we get to the point where it's a conversation of what can we do better for everybody through the community. Really, it's don't stop, don't accept an answer that you're not comfortable with. If you have questions, make sure you're bringing them up, um, and certainly reach out to broader resources. Like I say, there are a number of organizations that are out there that put on different programs. The funny thing with some of the doctors is people are afraid to talk to them sometimes, and they're normal people. They welcome the interaction at times. Now, in some of the appointments, can they seem very routine and very quick at times? Maybe, but I think, right, that's that point where if you're not comfortable with where it is, call a timeout. Hey, wait a minute. Certainly, uh, get a second opinion as well, right? If you're not happy with what you're going through, with what you're being told, there are tremendous resources that are available, through a number of organizations, and reach out to another MPN specialist. Again, I would advocate an MPN specialist over just another hematologist, somebody that understands, studies, specializes in MPNs. You will get, I think, better traction and better information coming back, if you can get to one of the major centers that can support that. I'm eternally grateful for kind of everything that has happened, right? Even the bad stuff helped drive me to find something better. So everything, they say everything happens for a reason, right? So, uh, I can't say how grateful I am to all of the people that have been involved. I mean, there are people that are totally unaffected by it personally from it, that have really dedicated their work and their time to helping others that are going through this. I'm very grateful that I've actually made the contacts that I have, have been given. I guess I was fortunate enough to live in an area that I actually have fairly close proximity to a number of places that have specialists that I can access if necessary. And then, all of the contacts that I've made kind of throughout, and it keeps growing, and not just the physicians and researchers and people like that, but it's the other patients too. And it's that kind of community support that when you really get tied into it, there are just so many wonderful people that'll really help kind of through the journey. So I look at it kind of where I hit kind of the lowest that I was, and compared to where I am now. Am I healthy and great for the short? I have myelofibrosis, but other than that, I'm healthy and I can enjoy things where there are other people that really aren't that fortunate. So even when it's bad, you realize that there are others that have it much, much worse. So.